Welcome to Journey to 600. Today on Journey to 600, we're talking about lung disorders, specifically restrictive versus obstructive lung disorders. So first, when talking about lung disorders, you have to understand the definitions of compliance, recoil, and what are the normal lung volumes. So in these pictures, the colors represent the lung tissue, and we're going to talk about the compliance and recoil. So compliance is the ability to stretch out during inhalation. So that lung tissue will pull on the airways to help expand the airways for inhalation to occur. Then that lung tissue will snap back to help push out the air during exhalation, and that is recoil. So compliance is the ability to stretch, so you can inhale, and the recoil is a snap back so you can exhale. These pictures show compliance based on how large or small the lung is. So for restrictive, the lung is very small compared to the normal, and the obstructive is very large compared to the normal. So compliance is greater in obstructive. It has a larger space. So obstructive disorders have greater compliance, which is observed by the larger space of the lungs. These pictures show recoil based on the amount of color inside the lungs. So in the restrictive picture, you can see the excessive amount of color, as the restrictive disorders have increased recoil. It has a stronger snap back during exhalation. Going a little bit over the volume, so tidal volume is the normal quiet breath in and out. Inspiratory reserve volume is the amount of air that can be forcibly inhaled after a normal tidal volume, and this is typically used in deep breathing. Expiratory reserve volume is a volume of air that can be exhaled forcibly after exhalation of a normal tidal volume. Residual volume is the volume of air remaining in the lungs after maximal exhalation. So after you've pushed out everything you can, what is still in the lungs is the residual volume. So putting this all together for restrictive, it has low compliance. Its ability to stretch is not high, so you will not have the ability to inhale a lot. That's why you have a decreased inspiratory reserve volume. Then you have a high recoil, which is a hard snap back. So therefore, all the volumes are going to be decreased because you can't get a lot in. Therefore, you can't get a lot out. So your total lung capacity is also going to be decreased. For obstructive, that high compliance leads to an increased total lung capacity. Expiratory reserve volume is reduced due to that decreased recoil, so it's not going to have that good snapback or normal snapback, so you're not going to be able to get out all that air. So expiratory reserve volume is going to be decreased, which also leads to an increased residual volume. This leads to an increased residual volume because you're not able to get it all out, so you leave more in the lungs. Which, as a reminder, this is why they eventually get that barrel chest, because there is so much volume that's staying inside their lungs. Okay, so knowing that, let's move on to what is a restrictive disorder. So restrictive disorder is due to stiffening of the lungs or alteration to the chest wall. This can be due to various conditions, musculoskeletal weakness, or musculoskeletal structural dysfunction. So examples of structural dysfunction might be scoliosis, kyphosis, ankylosing spondylitis. The musculoskeletal weakness, such as Guillain-Barré syndrome, Lou Gehrig's disease, or amyotrophic lateral sclerosis, polio, but conditions such as pulmonary fibrosis, sarcoidosis, and ascites can also lead to this restrictive disorder. So we kind of brushed over it earlier, but the volumes that will be affected would be a decrease inspiratory reserve volume, expiratory reserve volume, and residual volume, therefore overall decreasing the total lung capacity. And that is due to the decreased compliance and increased recoil. It's important to connect these diagnoses to the restrictive lung disorder so you can answer those two-step questions. So knowing that restrictive has decreased volumes, so knowing that they have GBS, I can say that's a restrictive disorder, and I know that that also decreases volume. PT intervention will be related to strengthening those weak respiratory muscles and help for secretion clearance. Obstructive lung disorders are due to narrowing or inflammation in the lungs. This is due to asthma and COPD. COPD includes chronic bronchitis and emphysema. The volumes affected will be that decreased expiratory reserve volume due to the decreased recoil, increased residual volume also due to the decreased recoil, and it will have an increased total lung capacity. PT intervention will include pursed lip breathing. So in summary, restrictive disorders are pulmonary fibrosis, ALS, and scoliosis. That's kind of one from each of the categories of conditions: musculoskeletal weakness and musculoskeletal structural deformities. Restrictive is reduced volume, so R and R. Restrictive is reduced. It is an impairment of the volume, so volumes are mainly decreased. Obstructive disorders are asthma and COPD. Obstructive disorders mean you have a problem getting air out, leading to that decreased ERV, but overall increased residual volume and total lung capacity. So O and O, obstructive disorders mean you have a problem getting air out. It is an impairment of flow for obstructive disorders. Okay, short lesson. Here's a practice question. A 55-year-old male patient with emphysema performs pulmonary function tests. Which of the following values will be decreased compared to age norm peers without pulmonary dysfunction? A. Inspiratory reserve volume. B. Expiratory reserve volume. C. Residual volume. D. Total lung capacity. So, I'll give you a minute to answer this question. If you're not ready to begin, please pause. So like I said, we need to know what the condition is to link it to if it's restrictive or obstructive. That can help us answer the question. So is emphysema restrictive or obstructive? If you don't recall, emphysema is part of COPD, and COPD is obstructive. So obstructive, this one only has one decreased volume, and that's what the question is asking for. Which of the following values will be decreased compared to age norm peers? Obstructive has trouble getting air out, so that means the expiratory reserve volume will be decreased, so B is the correct answer. Residual volume and total lung capacity, so C and D, would be increased in emphysema due to that decreased recoil and increased compliance. So B is the correct answer, expiratory reserve volume. Thanks so much for watching. Don't forget to like this video, subscribe to our channel, and turn on notifications. See you next time on your journey to 600.